Hi, I'm Aoife from Women's Health Dublin.ie. This video we're going to be talking about overactive bladder and how physiotherapists can treat it. So with our overactive bladder patient, we want to take a bladder diary to record the amount of times you are weeing during the day and night. And then we're going to put our treatment approach in place and then recheck on our bladder diary if changes have been successful. So what we want to do first is check the pelvic floor, see if the pelvic floor is weak, see if you have good contractions, see if you're able to relax properly. Some patients with overactive bladder will actually have high tone pelvic floor or very tense pelvic floor. So what we want to do with them is actually teach them how to let it go and contract properly. So it's really important you actually get an assessment in person to check how your pelvic floor are. The next thing we would advise people to do is every time they feel like the sensation that they need to void or go for a wee, that they squeeze their pelvic floor quickly 10 times and then calmly go to the toilet. If they can wait for 5 minutes, 10 minutes and slowly progress that wait time, that's brilliant. But the first thing we want to do is do our 10 squeezes so that we're kind of telling the brain from the pelvic floor that we've closed off the urethra, that it's safe not to go to the toilet, and then we wait our 90 seconds for that sensation or urge to pass. Then we slowly make our way to the toilet with the hope that over the days and weeks of training that you can actually really start to delay the time from when you feel that sense of urgency to go to actually needing to go. And then we reduce the number of times per day that you're going for a wee. We then start to see the same thing happen at night time. So we focus on day training and then we will see an improvement at night time, waking up less at night to go to the toilet. We would also recommend that when you wake up at night, you do your 10 squeezes, you wait your 90 seconds, see if the urge passes, and if it doesn't, you get up and you go to the toilet. So that is, in a simple explanation, our physiotherapy approach for overactive bladder syndrome. I hope that helps. I'm Aoife. I'm from Women's Health Dublin.ie.